Do you have any comments? Okay. And the LAO department? Nope. Okay. As a recent father, I'm open to this. So let me just see if there's any public comment on this. Seeing none, thank you for the presentation. I see we have a colleague here. I think I just saw. I think Mr. Ridley Thomas just walked in and walked out. So why don't we continue to issue 24, the electronic record staffing and monitoring and oversight budget change proposal.
Good afternoon, Assembly Member. Karen Johnson with the Department of Healthcare Services. So we're requesting 3 limited terms personnel, and program changes initiated by CMS have required the dedication of additional resources to accommodate such changes. HITECH Act authorizes state Medicaid programs to directly administer the EHR incentive program, and we have authorized over $1 billion to about 17,000 providers, and we hope to issue another $1 billion to another 15,000 providers. So these resources are needed to provide extensive data analysis, policy analysis, enrollment, eligibility support, and also provide technical assistance to professionals and hospitals.
Let me ask Department of Finance. No? LEO, any comments? And any members of the public? Okay, thank you very much.
Great, thank you.
Let's move now to HIPAA compliance and the monitoring BCP.
Right. So we're requesting to convert 8 resources from limited term to permanent. We continue efforts to maintain compliance and address new issues, new HIPAA rules, provide support of our CAPMAN, which is our capitated payments, and continue to provide oversight of privacy and security protection of beneficiaries. Since 1996, the policy has been updated, and recent change demonstrate that HIPAA will continue to evolve as technology, policy, capabilities, and standards are developed and refined. Be happy to answer any questions.
Thank you. DOF, LEO, public comment? Okay, let's move to issue 26.
Okay.
RFK Farm Workers Medical Plan.
Yes, we're requesting 5-year limited term funding. $220,000 in general fund and one-time $100,000 for system changes. The program established annual appropriation up to $3 million for reimbursement for claims that exceed $70,000 on behalf of eligible employees or dependent for a single episode of care. And this program is a non-governmental, self-funded, self-insured health plan that is between the United Farm Workers and multiple agricultural employees. Third-party liability division has the responsibility for ensuring Medi-Cal to comply with state and federal laws relating to the legal liability of third parties for health care services.
Okay, finance, LAO, public comment. Thank you very much for your efficient presentations.
Thank you.
Let's move now to item issue 27, Health Homes Program Activities.
Hi.
Hi, welcome back.
Thank you. So we are requesting 3-year limited term funding equivalent to 6 positions as well as contract funding in order for us to implement the Health Homes program.
Pretty straightforward.
Sure.
Okay. Finance, LAO, public comment.
Linda Way with Western Center on Law and Poverty. We co-sponsored the legislation that did the health home programs, and so are supportive of this measure. We do wonder why it's taken so long in terms of implementation. The original legislation was out in 2013, and so do want to know that this is a critical program that should be implemented as soon as possible.
Great. Tam Ma with Health Access and Support.
Karen Savage, National Alliance on Mental Illness of California, also in support.
If I could go back to the department. So I do see, looks like Senator Mitchell moved this in 2013. What took the time?
We've had a lot going on is really the answer, obviously, with the ACA and all of the work that we've been doing in implementing the various programs. We just haven't had the opportunity to really invest the time in this that we wanted to. We've also spent over the last year on a stakeholder process to develop the program and appreciated all of the input that we received. So we have now submitted the state plan amendment and are targeting starting the program next year.
Thanks. I know this sounds a little bit like the whole person care program that we're talking about in a different context, and I think we all want to see this get up to speed as quickly as we can, which we would appreciate. All right. Why don't we move to issue number 28?
Sure. So we're requesting 2-year limited term expenditure authority equivalent to 4 positions to continue the work of the outreach and enrollment grants that we've been providing to counties and others pursuant to several pieces of legislation that was linked to the Affordable Care Act.
Okay. Finance. Leo. Public comment.
Linda Way with Western Center on Law and Poverty in support of this measure.
Tam Ma with Health Access and Support.
Great. Thank you. Issue 29. Health Realignment.
So this is a request for an extension of 3-year limited term expenditure authority equivalent to 6 positions as well as 1 permanent position to continue the work related to this legislation that was passed sort of linked to the Affordable Care Act expansion. This is work that relates to the redirection of realignment funding to help support the expansion as well as these particular provisions related to the public hospitals.
Okay. Finance, LAO, public comment. Okay, next item.
So we are requesting 3-year limited term funding equivalent to 2 positions in order for us to implement the alternative payment methodology pilot for federally qualified health centers that was in SB 147 from last year.
Okay, finance, LAO, and public comment. All right, moving to the next issue. Let's call up Ms. Baylor.
I didn't see you. It's okay.
Good afternoon. This is Karen Baylor, Department of Healthcare Services. We're here to request some positions, 8 positions to support the implementation of our drug Medi-Cal organized delivery system waiver. As you know, we're doing this in a phased-in approach and changing the whole service delivery system here in California. Counties are required to submit us implementation plans. The first plan we have approved, we've received 9 plans so far. The final big push will be with CMS in finalizing the contract boilerplate and the CPE protocol, which we're very, very close to. As you know, with this improvement in the service delivery, we are adding in all of the CFR 42438 managed care requirements, which have never been there in the substance use disorder field ever before, which includes beneficiary protections, program integrity, and quality assurance. We're asking for 8 positions, 5 in 1 year and 3 in the following year to conduct the oversight and monitoring of these programs.
Could you tell me a little bit about what the programs entail when you talk about organized substance abuse disorder care?
Sure. So currently there is not an organized delivery system here in California. So beneficiaries can go anywhere they want to receive whatever benefit that is available, which is pretty minimal. Through the ACA and with the organized delivery system, we actually developed a full continuum of care from detox all the way down to recovery services. It has to be done in an organized way, meaning that each of the counties have an option to opt into the waiver. They will have a case manager who is assigned to the beneficiary. We're using ASAM, which is the American Society of Addiction Medicine criteria, as far as being able to assess the beneficiary and make sure that they're getting access to the right level of care. And so there's a lot of monitoring and oversight that will be needed because this is a whole complete different way of providing services here in California where there hasn't been the program integrity and quality assurance activities previously. And so we're requesting staff to help with monitoring and make sure that these programs are being provided in a quality way and meeting CMS requirements.
And how do you judge success at the end of the day?
We will develop a protocol like we do on the specialty mental health side where there will be disallowances if the patient is not placed in the right level of care or if their documentation is not accurate, we will disallow. And so one of the ways we will measure success is by looking at each county's disallowance rates. CMS considers 3 to 5% to be around average for disallowance. And so that's our target, to make sure that all the counties are under that 5% disallowance rate. That will be one way. Another way will be when we do the chart audits is to make sure that the clients that came in and were assessed were able to access the right level of care. And at the end of the day, what we really want is good quality care for people who suffer from substance use disorders. As you know, there's a huge epidemic right now. We're looking to expand medication-assisted treatment, and so one of the other goals would be is to reduce deaths due to opioid or heroin overdoses.
Okay, thank you. Finance? Elio, public comment? Okay, let's move to issue 32, Mental Health Services Act funding.
Right. This is requesting a reappropriation of $1.9 million MHSA funds that were unexpended. Frankly, we thought they were one-time funds and didn't realize for the past 3 years that we had the money available, and so we're asking for reappropriation. It was initially funded for the purpose of providing technical assistance, development of outcome measures, performance metrics, improving the data source, and to strengthen data reliability and validity. So we're asking for the money in order to do three things. One is we have a very old computer system that wasn't able to be put into the DHCS warehouse because it didn't meet DHCS requirements. So it's in what's called the data migration zone. We want to be able to get the system up to a point where it meets DHCS requirements and get it into the data migration zone. We also are requesting the funds in order to help redesign our website so that the data that we are able to post is easily accessible and transparent. And then we want to be able to improve the quality of the data in our two major data systems so that we have accurate data and transparency for all the counties and stakeholders.
Ask a question. So this is money that had been sitting in an account in 2013 to 14, 14 to 15, 15 to 16, and you guys just figured this out.
Yes.
How did that happen? Just curious.
I'm not, do you know?
Probably because budget chairs just flew through too many issues too fast.
We can get back to you.
Yeah.
I'm not sure exactly how it was discovered or when it was discovered, but we recently discovered that it was our impression that was one-time funding, and then we found out it wasn't. It was ongoing funding.
I asked a similar question, I think, last week. I'm always amazed when it comes to IT funding how there doesn't seem to be a very strong connect between the departments and what we're doing on the IT level, and budgets seem to be moving around, and lots of money seem to be not particularly as accounted for as we'd want it to be.
In this scenario, I really think it had more to do with the transition of the former Department of Mental Health into Department of Healthcare Services, and there were a few hiccups with that transfer, and I think this is one of them.
Okay. Anything you want to add, Finance? Nope. Elio, public comment.
Thank you, Mr. Chairman. Rusty Steelix, California Council of Community Behavioral Health Agencies, Mental Health America of California, and also as one of the two original co-authors of Proposition 63. And I just wanted to put this in context in that since the inception of the Act, there's been enormous, supporting this proposal, but also going beyond that, there's been enormous stakeholder frustration with the lack of ability to get information on where is the money going, who is it serving, and what are the results. And so we would ask that this year, since we have $52 million of cumulatively unspent funds, that we would ask DHCS and the Oversight and Accountability to come back to this committee and come back with what do we need to really get all the data and all the information we need. More specifically, we don't even know just the simplest thing of having a reporting form where the counties report on where their funding went in each category of the three main categories of spending each year, so we can compare county by county, year by year, and see where all the money is going. Right now, there's a belief that there's a whole lot of money that's been allocated to the counties that hasn't been spent at all, and why is it and how much and how we're doing. So we would ask that support this, but also ask them to come back and perhaps calendar it at a future agenda item to look at, as long as we're going to fix the reporting system for the mental health services excellence really fix it. Thank you.
Could you respond to the last public commenter and your perspective on that if we're talking about that level of money? Do you share the perspective?
Yeah, I think what Mr. Seelix is talking about is more on the fiscal side. What we're looking at here is more on the data and demographic and who's being served side of the house. I share his sentiment on if we're going to fix it, let's fix the whole thing. I do acknowledge that there's been frustration from stakeholders and others regarding the lack of understanding and knowing where MHSA funds are being spent on the local level. So we would be happy to have conversations, more conversations with the department or the Oversight and Accountability Commission and with Mr. Seelix and others to see what kind of proposal we could put together to find out what we need to do to fix this.
Okay. If you could, you were going to get me some more information after this. If you could give me a little bit more background on your response to
Sure.
what he just asked, that would be helpful.
Sure.
Okay. Let's move to the next issue.
Sure. So as we've talked about previously in this committee, we have our waiver renewal was approved at the end of December and has 4 main programmatic components that we've talked about: Prime, the Global Payment Program, the Dental Transformation Initiative, and Whole Person Care. Obviously, a lot of new programs and exciting things for us to do, and so we need staff resources and contract funding in order to complete the work that we are required to do under the waiver. So we are asking for 5-year limited term funding to support 29 positions, 2-year limited term funding to support 2 positions, as well as 5-year limited term funding for various contractual services for us to do the work of the programs as well as all of the assessments and evaluations that we're required to do under the waiver.
Great. I didn't have a chance to ask this earlier when it came to the stakeholder proposal, but one of the programs being proposed under the Whole Person Care Pilot is around Medi-Cal housing. Mm-hmm. Wondering what your perspective is on that.
So the waiver does allow for non-federal funds to be spent on county housing pools and those things. Obviously, we did not envision state funding for that. That's not a part of the governor's proposal, but it would be permissible under the waiver.
So is that something you're open to, could support?
Obviously, that would be something the administration would have to discuss more internally before I could offer a particular position.
Sure. Well, look forward to the conversation.
Sure.
Certainly the program is one that we think a year one investment would lead to significant ongoing savings. So hope we have a chance to make a good case around that. DOF, LAO, public comment.
Tam Ma with Health Access and Support.
Linda Way with Western Center, also in support, and we echo the chair's comment that we do think that some of the housing proposals do align nicely with the whole person care.
Kieran Savage, National Alliance on Mental Illness California, also in support and really looking forward to the whole person care pilots getting up and running. Thank you.
Thank you. Let's move to issue 34. Hello.
Hello. Karen Johnson, Department of Healthcare Services. So this proposal removes a sunset date provision, which will allow the Department of Healthcare Services to use the information from the Department of Industrial Relations, as it is the primary source for identifying non-contested workers' comp claim files and unreported workers' comp files. Social Security Act mandates DHCS to take all reasonable measures to pursue reimbursement of Medi-Cal costs for treatment provided to injured workers where employer has fiscal responsibility. With this data, DHCS expects to return about $400,000 in annual recoveries. Happy to answer any questions with regards to this proposal.
Great. Finance? LEO? Public comment? Okay. Thank you very much. I know there's one open item. I think we're waiting for a colleague to come back. So I think at this time we're going to temporarily recess, unless we should. Okay, we're going to temporarily recess. So thank you all for coming, and we'll probably pick up in 5 minutes.
vision to provide technical assistance and analysis in development and expansion of school-based health centers. Mr. Chairman, you are aware of school-based health centers. They make the nurse's office at schools look like a throwback of the past. They are effective. They are run typically by federally qualified health centers, and they help improve the health disparity gap. They are also more viable than even when this program was originally envisioned some 10 years ago now, because Obamacare has created a pay mix where dollars are attached to the pupils and their families that might utilize these school-based health centers that are run by FQHCs. These are in public institutions. We think it a meritorious program, and with your advocacy and support, the committee's indulgence, and the full budget committee's seal of approval, we think that this is something that can improve health outcomes for students in California schools and their families. We have witnesses that can attest to the merits of the proposal.
Thank you, Assembly Member, and we appreciate your leadership on this issue, and you're correct. We believe in school-based health centers, and I appreciate the lens through which you framed the discussion about improving student outcomes. I heard it just the other day that 2/3 of what gets in the way of student learning is non-academic. We know that kids come to school hungry, they come to school hurting, they come to school with physical, mental, dental needs that often are not met. And the school-based health center is a model that is proven to help them. And so while we're not able to act on it today, it has been a priority for the committee to hear these items and enter them into the discussion here in the Budget Subcommittee. So again, we thank you for your leadership and your presentation. We welcome any witnesses that you have to present.
We have multiple witnesses.
Thank you, Mr. Chairman. Alice Kessler. I'm here representing the California School-Based Health Alliance, and we're a statewide organization that works to put more health services in schools. We support this modest but very meaningful proposal and thank Assemblymember Ridley Thomas for championing this issue. As he mentioned, this program was established 10 years ago, so it's very exciting to see some hope that it may finally be funded. You know, I think Mr. Chairman and Mr. Ridley Thomas understand very well why school-based health centers are such an effective model, and even with the expansion of healthcare under the Affordable Care Act, there's still significant gaps, especially in our most economically distressed communities. We still see far too many children with obesity, asthma, mental health, behavioral health issues, and school-based health centers just make sense. Serve those kids where they are at school, and it improves both their academic and their health outcomes, and it's evidence supported. So we look forward to continuing to work on this as it moves forward in the budget process.
We couldn't agree more. Thank you, Ms. Kessler. Ms. Cantwell, did you want to add anything from the Department of Healthcare? Thank you. Anything from Finance? No comment. Anything from the LAO's office? Is there any public comment on the proposal?
Hi, Mr. Chairman. Beth Malinowski from the California Primary Care Association, representing over 1,000 sites across the state, serving 1 in 7 Californians. We're really excited to be here today in support of this proposal. As Mr. Ridley Thomas shared, over 55% of school-based health centers are affiliated with FQHCs, federally qualified health centers in our state. We believe it's an incredible program. It's good for children. It's good for their families. It also really creates a picture for folks about healthcare careers. So beyond creating excellent care, it's also really serving as a model to excite students about working in healthcare professions. So I just wanted to add that note as well. So again, thank you for taking the time today to hear this, and we urge your support.
Thank you.
Good afternoon, Katie Andrew from Children Now in support of this important proposal to bolster school-based health centers. Thank you.
Thank you. We have so many traditions in the state and locally to support the needs of students that align with what you've asked, whether it be the Healthy Start program, whether it be the full-service community schools movement. And so we know that as Ms. Kessler said, that this is evidence-based, and we appreciate your leadership here, Assemblymember Ridley Thomas. And having said that, we'd like to give you the last word if you have any closing remarks on the proposal.
Well, I would simply add, as you know, Mr. Chair, when you and I went to school, we had actually fully functioning nurses' offices, and LA Unified, every school had a school nurse. That's no longer the case. Things have changed with the economy. So we think this is a prudent program. It's fiscally responsible. It will potentially, with these two positions, help bring in external resources, federal and non-governmental resources, and help achieve health parity and improve access to health care. So we hope that you consider this proposal strongly and that we can get this through the budget process and ultimately enact it to improve the quality of life for all California kids.
I want to thank you, Assembly Member, and I look forward to what will be ongoing and rigorous discussion on this matter when we reconvene and when we are more fully constituted for conversation as it relates to what the final budget will look like. We appreciate your leadership, and thank you for being here today.
Thank you, man.
Thank you.
Sure.
Thank you to all of our witnesses and public comment as well. Do we have any other items? Recognizing that there are no other items, I want to thank all of our presenters, all of the members who presented, everyone who spoke in public comment. I want to thank our committee staff for their great work. I want to thank my staff for their great work and thank the staff of all of the departments and finance and the LEO's office. This meeting is adjourned. Thank you.